Good morning. Welcome back to Open Medscope. Today I'll be discussing an MCQ on thyroid disorder. It's a history of a 45-year-old female with a dry skin, puffy face, and non-beating pill edema. She has brittle hairs, thinning of outer third of her eyebrows. What is the most likely diagnosis? Obviously, this patient's clinical features fit in with hypothyroidism. So the question is, what is the most common cause of hypothyroidism? In iodine deficient areas, or if we take globally, it is iodine deficiency. In other places, the most common cause is Hashimoto's thyroiditis, which is an autoimmune disease and is the most common cause of hypothyroidism. CD8 cells attacks the thyroid cells and destroys it. At the same time, the B cells get activated, become plasma cell and produces autoantibodies. One among them is TPO antibody. But mainly the destruction is due to the CD8 cells. Now we think about what are the common causes of hypothyroidism. Hypothyroidism is basically divided into primary, secondary, and sometimes called tertiary also. Primary is due to thyroid dysfunction. The cause is at the thyroid level. Secondary means it is either due to the pituitary, and tertiary if it is hypothalamic dysfunction, or sometimes both are combined together. So among the thyroidal causes, after iodine deficiency, it is autoimmune hypothyroidism, the Hashimoto's thyroiditis and atrophic thyroiditis. These are the most common cause. Second comes the iatrogenic. These two constitute around 90% of all the causes of hypothyroidism. Iatrogenic includes iodine 131 treatment, subtotal or total thyroidectomy, external radiation for lymphoma or cancer. Drugs are very important. Iodine excess, including iodine containing contrast, amiodarone, lithium, antithyroid drugs, paraamino, salicylic acid, interferon alpha, and other cytokines. Thyroxine kinase inhibitors, including sunitinib, immune checkpoint inhibitors. These are all important causes for hypothyroidism when the patients are on drugs. Congenital hypothyroidism can be due to at the level of pituitary hypothalamus, or it may be due to thyroid dysgenesis or dyshormonogenesis, that is, hormones are not produced properly in the thyroid. Can be due to mutations on the TSH receptors. Infiltrated disorders, including the amyloidosis, sarcoidosis, hemochromatosis, scleroderma, cystinosis. Overexpression of type 3 deiodinase. This is seen in infantile hemangioma. That is, the T4 is deiodinated by type 3 or deiodinases. And type 3 deiodinase is seen in hemangiomas and some tumors. This can also lead on to hypothyroidism. This is a very rare cause. Then transiently hypothyroidism can occur. This may be due to silent thyroiditis, postpartum thyroiditis, subacute thyroiditis, all these self-limiting. Withdrawal of supraphysiological dose of thyroxine, that is, patient is given thyroxine in an intact thyroid gland. This may lead on to, just like the steroids. When the steroids are given for a long time, when you withdraw, the patient may go into anisonic crisis, similar to that. After iodine 131 treatment or subtotal thyroidectomy for Graves' disease, you can get transiently hypothyroidism. Then the most important, even though rare, is the secondary hypothyroidism. It may be due to hyperpituitarism of varying causes like tumors, pituitary surgery, radiation, infiltrated disorders. Remember Sheehan syndrome, that is the postpartum bleeding leading on to necrosis of the pituitary. This can lead on to amenorrhea and failure of lactation. And mutations in the various genes can lead on to combined hormone deficiencies of pituitary, including TSH. Isolated TSH deficiency or inactivity can occur. Hypothalamic disease, again, tumors, trauma, infiltration, or idiopathic can lead on to hypothyroidism. So we have discussed the various causes of hypothyroidism. We have divided the hypothyroidism into primary, secondary, and tertiary. Among the secondary, very important condition, remember, one is the Sheehan syndrome, pituitary tumors. Third, in our place, snake bite, especially the viper bite, can lead on to pituitary failure at a later time or immediately following because of the bleeding occurring.